Thank you so much for coming and being here. My name is Manjula Narasimhan. I work in the Department of Reproductive Health and Research here in Geneva at WHO. And welcome to the side event to the World Health Assembly on catalyzing innovation and progress through self-care interventions. It is my pleasure to introduce Dr. Ian Askew, who's the Director of the Department of Reproductive Health and Research at WHO, and also the Director of HRP, and will be moderating this side event. Thank you very much, Ian.
WHO has had a definition of self-care for many years. Our working definition of self-care is the ability of individuals, families and communities to promote health, prevent disease, maintain health, and to cope with illness and disability with or without the support of a healthcare provider. So this is our working definition of self-care. However, times are changing, and more and more the ability of people to undertake self-care interventions with varying degrees of interaction and engagement with the health system are rapidly changing. And as we move forward in this era of trying to achieve universal health coverage, and with a particular focus, as you've heard several times this week, that primary health care is the main driving mechanism to reach universal health coverage, and also that people-centered care has to be at the core of countries' approaches to universal health coverage. Looking at interventions that enable self-care is a critically important element going forwards. Consequently, we've started a process at WHO of developing normative guidance around self-care interventions. And this event is to try to raise awareness about this process of developing normative guidance and to encourage you all to participate in the movement forwards. We're taking as a starting point self-care interventions around sexual and reproductive health and rights. This we could start in other parts of the health community, but we're starting with this one because this is an area where already there are a number of examples of self-care interventions that WHO already has some guidance around. For example, we already have guidance around HIV self-testing. We already have guidance around self-management of safe abortion. And new recommendations are going to be coming out over the next few weeks and months to augment these existing ones. Our guidance will be a consolidated guidance across the range of health topics, and consequently the guideline will be a living guideline that will be evolving and changing over time as new evidence is brought together, compiled, and recommendations developed. This is an important time to recognize and acknowledge the importance of self-care within the overall approach to trying to broaden service delivery. As I've mentioned, universal health coverage will require multiple pathways to be achieved, and countries are expected to go about this in the way that they feel is most appropriate to their own situation and most appropriate to their norms and standards within the countries. However, I think we can all agree that globally, self-care should be seen and should be encouraged as long as it can be done safely and effectively, and that it doesn't jeopardize people's well-being, and that people feel in charge of looking after their own health choices. We will be launching the guideline on June the 24th, so please put that date in your diary. There will be an event here in Geneva at the World Health Organization. And following on from that, there will be a number of other events and communication opportunities to learn more about this. This event for today, we're preceding the guideline because we wanted to take advantage of having so many people participating here at the World Health Assembly. And we're particularly grateful to the governments of Bangladesh and the governments of Namibia for actively participating in this event today. And we look forward to hearing from the ministers of both countries to provide us with their perspectives on this important issue. Our keynote presentation will be given by the the Minister of Health and Welfare from Bangladesh. He will be joining us shortly. As we await his arrival, I would like to ask the Minister of Health, the Honourable Minister of Health and Social Services from the Government of Namibia, to give his presentation. This is His Excellency Dr. Kalumbi Shangula. Dr. Shangula is a doctor and a politician from the SWAPO party, and since December 2018, he's been the minister in the Ministry of Health and Social Services. Prior to this, Dr. Shangula was the vice chairperson of the University of Namibia's Medical School. Previously, he's been permanent secretary at the Ministry of Health and Ministry of Environment and Tourism. And previously, he was a managing director of SWAPO's Kalahari Holdings Group. So, Dr. Shangula, please, the floor is yours, and we look forward to hearing about Namibia's perspectives on self-care. So, thank you.
Thank you very much. Is this one working?
Yeah.
Oh, thank you. Make my work easier. Thank you very much, moderator, for giving me the floor. Members of the high table, distinguished invited participants. Let me first express on behalf of Namibia our profound gratitude and appreciation for the kind invitation extended to us to participate in this event. I will have a very brief remark to start off the program. I'm very pleased to join you here this evening. Self-care intervention for health, including self-testing, self-diagnosis, self-management, self-medication, and self-monitoring can transform health systems and accelerate progress to advance universal health coverage. Promoting user autonomy and agency through a person-centered approach empowers individuals to be powerful actors and places them at the center of and as decision makers in their own health. This paradigm shift in healthcare delivery is particularly important in situations where stigma, discrimination, and violence have for decades impeded a person's ability to access, uptake, and be retained in health care. Empowerment is a process through which individuals and groups acquire more control over their lives. Through this increased control, they are able to defend their rights, reduce inequities, and bring about positive change in their communities. Supporting self-care interventions can empower individuals and communities to change the social forces around them. This is particularly relevant for women and girls, as gender inequities have led to increased imbalances and disparities in reaching the most vulnerable women and girls with quality health care. With self-care interventions, this can change. We can provide everyone with quality tools, information, and products with which they can transform their lives and make informed decisions about their health. The foundation for robust health systems include provision of services where increased user autonomy can lead to people voicing their needs and making choices with regard to their health care, and not predominantly accepting what the health care providers decide they need. This is the simplest explanation of universal health coverage that enables everyone to obtain the health service they need when and where they need them. A better understanding of ethical, legal, and social implications of self-care intervention will also be essential. Defining who is ultimately accountable for the safety and efficacy of self-care interventions is vital for success and sustainability, and particularly important when it comes to vulnerable populations, including women and girls who may prefer self-care and choose to not engage with healthcare services to avoid stigma and discrimination. We welcome the first WHO consolidated guidelines on self-care interventions. This innovative approach will be a game changer for WHO and for member countries to shift away from a uniquely biomedical perspective to a user-focused agenda. For countries and individuals worldwide, this shift will mean that the public health community can move from an ill health prevention perspective to promoting a holistic approach to health and well-being. I thank you for your kind attention.
Thank you very much, Honourable Minister. Indeed, excellent comments, and Namibia is clearly giving a lot of thought and attention to this approach, and we look forward to hearing more from you in the future with these excellent initiatives, and I'm sure you'll be able to share many lessons in the years to come. Our next speaker is Dr. Nadia Bezad. Dr. Bezad is an expert in leadership, management and planning of sexual and reproductive health activities and a leader in ensuring information, education and communication in relation to the prevention and management of sexually transmitted diseases and including HIV and AIDS. Dr. Bezad is speaking, and in fact, on behalf of the Minister of Health from Morocco, His Excellency Anas Dukali, who unfortunately was unable to be with us. But we look forward very much to hearing from Dr. Bezad, because as with Namibia, Morocco is also trying to break some new ground with the self-care approaches, and I think it'll be some interesting lessons to be heard from Morocco. So, Dr. Bezad, please.
Thank you. Honorable attendees, on behalf of His Excellency Mr. Anas Dukali, the Minister of Health for Kingdom of Morocco, I am delighted to share with you all the Moroccan experience regarding the adoption of self-care intervention for health, including sexual and reproductive health and rights. Morocco, like other member states, adhere to the Astana Primary Health Care Declaration, which highlights the importance of empowering individuals, families, and community to optimize the health advocating for policies that protect and promote health and well-being as co-developers of health and social services and as self-cares and caregivers. Morocco's senior management have contributed to the regional consultative meeting on adopting self-care interventions for sexual and reproductive health and rights in the Eastern Mediterranean region, conducted by the WHO Regional Office in Beirut, April this year. Following this meeting, the Moroccan Ministry of Health decided to deploy all efforts to ensure the adoption of self-care interventions for sexual and reproductive health. The priority self-care interventions regarding sexual and reproductive health were selected based on the forthcoming WHO consolidated guidelines on self-care interventions. Morocco will promote and implement following actions: HPV self-sampling to be offered as an additional approach to clinician-based sampling and cervical cancer, self-testing of sexually transmitted infection to be offered as an additional approach to deliver STI, HIV testing services, over-the-counter availability of oral contraception, COC, and POP to be offered as an additional approach. Ladies and gentlemen, the Ministry of Health has also involved a national NGO, OPAS, Pan-African Organizations Against AIDS, to lead the community-based initiative regarding self-care interventions on sexual and reproductive health. OPAS has already started advocating with parliamentarians on the role to adopt self-care interventions into national health policies and regulations and ensure their programmatic sustainability. OPAS is actively working on ensuring the training of community health workers on this activity to contribute to women and couple well-being. The WHO Collaborating Center on Reproductive Health Training and Research, which works as a tertiary hospital in the capital of Morocco, is also engaged in the adoption of self-administration DMPA-SC, of oral contraception and fertility regulation with the great support of the Ministry of Health. Once officially published, the WHO guidelines will be disseminated to all concerned parties and sectors involved in the subject of women's health and well-being. The Ministry of Health counts on ensuring the integration of existing sexual reproductive health guidelines within the existing reproductive and maternal health policies, programs, and practices. The Ministry of Health encourages the involvement of the H6 partners, including WHO, UNICEF, UNFPA, UN Women, UNAIDS, and the World Bank to jointly plan and adopt the sexual and reproductive health self-care interventions for better convergence and synergic impact. Morocco is committed to support the development of a resolution on self-care interventions to be presented to WHO 2020. Finally, the Ministry of Health would like to take this opportunity to warmly thank the WHO teams at headquarters, the Eastern Mediterranean region, and the country office for their unconditional support, and we remain committed to promoting sexual and reproductive health and rights of the Moroccan population. Thank you.
Well, thank you very much indeed, Dr. Bazad, and please convey our thanks to the Honourable Minister. The message was very loud and clear about the leadership that Morocco is currently providing, and we look forward to hearing more about these very interesting approaches that you're developing. And certainly with the Collaborating Centre, it will be good to continue to work together on those areas. So thank you again, and please convey our thanks to the Minister and to his ministry for the great work they've started on this area. So thank you. Our next speaker is Dr. Anders Nordstrom. Dr. Nordstrom is the Swedish Ambassador for Global Health at the Ministry for Foreign Affairs in Stockholm. He's well known to many of us and has had a very varied career in many aspects of global health. At one time, he was working here at WHO and in fact was acting Director General of WHO for a while. He's recently been heavily involved in the work around the Ebola outbreak and has served on the board of the Global Fund and in many other capacities. Anders will hopefully talk us to a little bit about the experience for Sweden in this area. In many areas of health generally and in sexual and health, reproductive health particularly, Sweden is often seen as a global leader. So we're looking forward to hear Sweden's thoughts and actions in this area. So, Dr. Nordstrom, please.
Thank you very much, Ian. Let me first say that, self-care is happening. It's happening in all societies everywhere. If you go to a local market, you will find people buying drugs. There is a discussion now up in the Committee A about AMR, the involvement now on antibiotic resistance. So there is self-care happening, and self-care that sometimes is bad. But there's also a lot of new opportunities in the societies we are living in today, including in my own in Sweden, where people are becoming more part of actually both preventing disease, diagnosing disease, and also treating disease. So we have a different kinds of society today, especially when knowledge is available in a different way than it used to be. So from the Swedish side, we very much welcome this from WHO to be more proactive, talking about how can countries do this in a way that will also improve quality. And not just those guidelines, but also the guidelines that WHO issued on digitalization, digital health, is also very, in some way, complementary to this, because at least in my society, a lot of self-care is actually happening over internet. Getting access to diagnostic, buying drugs, etc., etc. So the combination of here seeing what is possible, and I'm going to come to what we de facto are doing in Sweden. But let me first say that underlying self-care And in some way, the work on health more generally, I think is also as the Honourable Minister was saying, the empowerment of people. And if we are really serious about the empowerment of people, we need to think a little bit in terms of what is it actually enabling people to make more healthy choices. Whether it's healthy choices to be able to stay away from disease, or healthy choices in order to be able to know whether you have a disease and how you should treat it. At least from my perspective, one needs three things. One needs to have access to knowledge. Very often, if we look across when it comes to looking at whether that is enough for people, it's often not. But knowledge is important. The health literacy as part of self-care is an important component. The next one is then resources, to be able to afford, to be able to have access to then what is de facto recommended. And here there are many challenges here, both when it comes to poor people actually being able to afford, or to be able to afford the right things and not the wrong things. And sometimes, unfortunately, some of the health choices are not the cheapest ones. But most importantly, I would say, enabling people to make more healthy choices are actually what is there in terms of social values, cultures, peer. What are your friends saying? Are your friends encouraging you to do this and to make a certain choice? And I think one needs to have that understanding in terms of that environment where you also work on self-care. Sometimes, not always, but when appropriate, it's important also to involve families and colleagues to have a good understanding if you have a person that you recommend self-care. So self-care in Sweden, it's been regulated since 2009. It's the National Board of Health and Social Welfare that issued guidelines. Those guidelines are basically including recommendations in terms of what is appropriate for self-care. And this is something one are reviewing, saying that this is an area, this is something that we feel that is actually appropriate actually also to recommend for self-care. The guideline says also that self-care should be documented, and especially when it coming from the health sector, from the health service, it should also then, people should be able then, or the profession, do have a responsibility to follow up and to monitor if self-care has also been recommended. So we have a reasonably good sort of framework in place, both to recommend what and when, but also who's actually de facto responsible for it. I will end just by coming back to this to say that self-care as one instrument, and if we through WHO now can be more proactive in terms of improving quality. Because again, we have a lot of self-care in our societies. We have societies that are evolving very quickly, especially when it comes to the knowledge. There are a lot of knowledge, some good, some bad, some wrong. And in order for people to be able to make the right choices, to develop tools, to understand how can you work with people to enable them to basically have access to more effective care or prevention, an extremely important work of WHO, and I also appreciated my colleague from Morocco also mentioning some of the other UN colleagues from the Swedish government. Of course, we are strongly supporter of the UN system, both the 5 UN that are part of the H6, but also the World Bank being a very important technical and policy partner to that. Thank you.
Thank you very much indeed, Anders, and for putting that into another country context. And I wanted to pick up on the point you were making about looking beyond the health system. And this is part of a broader issue around how societies are organized and how healthcare is seen within a broader societal context. I wanted to raise this because our next speaker represents parliamentarians, and we have a few parliamentarians in the room. Honourable Mr. Christian Lohr is a Member of Parliament for Switzerland, but he's also a co-rapporteur for the Interparliamentary Union's committee that is developing a resolution on universal health coverage. And so the Honourable Lohr is going to say a few words about what role the parliamentarians can play in trying to encourage and enable an approach to self-care that meets the needs of society as a whole. So, Honourable Lohr, over to you, please.
Thank you, Mr. Chair. Your Excellencies, distinguished colleagues, ladies and gentlemen. The principle that health is a fundamental human right is true today as it was 70 years ago, and everyone And I mean, really, everyone on the world should be able to realize that right. Whoever they are and wherever they live, people should be able to get the help they need without any form of discrimination. But today, at least 400 million people worldwide lack access to the most essential health services, and millions risk poverty because they have to pay for health care out of their own pockets. Universal health coverage enables everyone to obtain the health service they need, when and where they need them, without facing financial hardship. Achieving universal health coverage will mean finding innovative solutions, and among the most innovative solutions is something people have been doing since the dawn of the time. That is self-care. Self-care interventions means providing services that are built around the needs and rights of people. Self-care intervention is particularly relevant to reaching the most vulnerable population, and in doing so can reduce health inequities. Because when people are not coming into health services due to poor quality care or access or lack of knowledge of their right, or inability to pay, or discrimination, or they need health services for any reason, self-care intervention offers a unique solution to improving their autonomy and health decision-making power. The increasing availability of over-the-counter products, information services, and intervention are changing healthcare delivery. In high-income countries such as Switzerland, these products are regulated, but in some other settings, the lack of regulation or substandard products could lead to poorer health outcomes. For example, if antibiotics are prescribed in a partial doses or taken incorrectly or of poor quality, this could lead to antimicrobial resistance, which we know it's a growing global threat. This makes the need for evidence-based normative guidance from WHO very relevant and timely to ensure that quality self-care products, information services, and intervention can be offered to individuals everywhere, whether they are self-care carriers or caregivers. The Sustainable Development Goals give us the really good, the really wished platform and the political mandate, not just to improve health outcomes, but to transform the health system on which billions of people depend. The world has committed to achieve universal health coverage by 2030, and we all have a role to play, including parliaments. Within the next context of the global commitment, the Interparliamentary Union has initiated the process of development of a global parliamentary resolution on UHC. And I'm honored to be one of the three co-rapporteurs, together with Honorable Professor Millet from Parliament of Bangladesh and Mrs. Carvalho from Parliament of Brazil. IPU's resolution on UHC offers a unique proposal to put the individual at the center, including through the integration of self-care as a part of the most innovative ways to address the existing gaps in quality service delivery. Thank you very much for your attention.
Thank you very much indeed, Honourable Mr. Lohr, for these insightful remarks about the roles of parliamentarians, and we're very happy to hear that self-care will be considered as part of the resolution that you're developing around universal health coverage. It's good to hear that endorsement from such an influential body of people that are working alongside the health system. So we very much appreciate that commitment and looking forward to continuing to work together to achieve these joint aims. So thank you for that. Our next speaker represents the next generation of healthcare workers. We've talked about self-care as becoming a thing of the future, but it's already a thing of the present. But if it's going to be there in the future, that will change the way in which health systems and health services function. So we feel it's important to hear from some of the future people providing healthcare services. So our next speaker is Dr. Charlotte O'Leary. Dr. O'Leary is the liaison officer to WHO from the International Federation of Medical Students Associations. Charlotte holds an MSc in Public Health Economics and is completing her final year of the Bachelor of Medicine, Bachelor of Surgery from Monash University in Melbourne. So Charlotte, please, over to you.
Thank you. Thanks, Dr. Askew, and it's such a privilege and an honour to be speaking on this panel today. Just a slight correction, I'm not actually a doctor yet, 6 months to go, so I had a bit of a promotion on this panel. Thank you for that. So I'm here representing the International Federation of Medical Students Associations, which is a federation of 133 national member organisations from 123 countries. So together we represent over 1.3 million medical students, so we have quite a reach. IFMSA had the privilege to be involved with the consultation process for these self-care guidelines right through from in-person consultations to our own internal consultations with our members about self-care through surveys and through our meetings as well. So we really think this has been a model of engagement for young people and for future health professionals with guideline development from the WHO, and we really thank them for that. We thank the WHO for recognising future healthcare professionals and young people as key stakeholders in this issue. To us, it's very obvious that engaging future health workers is crucial to the success of self-care interventions, because the way that we as healthcare professionals and workers are taught to communicate with patients, and the way that we're taught to educate patients, and the way that we're taught to empower patients is going to influence generations of people and their health and their experience of self-care. So my main point today is going to be on education and training of healthcare workers, but I would like to also just address the global workforce situation. So as you probably know, we are facing an 18 million shortfall of healthcare workers by 2030, and there's a very unequal global distribution of this. So we really see empowering patients in their self-care as a fundamental way to support, complement and augment the work that healthcare workers are already doing. And people really need to be engaged in their own care if we are going to bridge those critical gaps that we do still have all over the world. Having said that, self-care interventions cannot replace a robust healthcare system which is equitable, accessible and affordable. And we absolutely need to work in partnership with trained healthcare workers so that patients are accessing self-care interventions that are safe and effective. So my main point today is about education and training and the need to really invest in healthcare workers and future healthcare workers if you want self-care interventions to be effective and safe. Professional attitudes towards health are developed and nurtured during education and training, and this is the best opportunity to effectively teach new approaches for service delivery. So for me, to enhance the self-care agenda, we need to train healthcare workers to be 4 things. Firstly, we need to train them to be patient educators and to increase health literacy in the population, and a number of my fellow panelists have mentioned this already. So Natasha Mwanza, the very inspiring speaker from Monday's opening plenary, said that we lose people to ignorance, and I think this is very true, and we all know that improving health literacy and improving education is key to improving health. And if you instill in health workers from the first day of their training a culture of educating and a culture of teaching, you will amplify health literacy in the population, because we as healthcare workers have access to people in their communities, and that is so important. For me, from my first year of medical school, I was examined on my ability to educate patients and to communicate with them information in a systematic and a comprehensive way. And whether that's explaining to a woman how to use the contraceptive pill effectively, or explaining the physiology of diabetes to someone with a new diagnosis, I really developed methods of communication that I can apply across my whole practice and across my whole career. So I'm really thankful for that and for my university recognising that. On this point also, IFMSA members and young people are actively working at the national and local level to improve health literacy in the communities. And they are out there doing this when governments and healthcare systems are not, and they are seeing the gaps. So I implore you to invest in young people and to support the projects that they are doing, because they do really understand this issue and they are out there working on the ground. So secondly, we need to train healthcare workers to be patient advocates and to support people to be equal partners in their healthcare. We, as the next generation of healthcare professionals, have an obligation to challenge traditional power structures within the healthcare sector. And we need to get rid of the traditional paternalism, which limits the autonomy of patients, and we need to empower them to be equal partners in their care. And this is how we will get patient-centred care and how we will have effective self-care. Thirdly, we need to train healthcare workers to be compassionate and empathetic communicators, because embracing self-care requires trust. It requires people to trust that a healthcare worker will be there when their self-care doesn't work out. And that is very important. If you are self-initiating an abortion, you need to know that someone is going to be there if something goes wrong. And that requires trust both ways. And we need to be compassionate and empathetic communicators in order to deal with that. And lastly, we need to train healthcare workers to be team players and to embrace interprofessional collaboration, to really harness all the competency of healthcare workers so that we can really strengthen self-care across the entire healthcare system. So in summary, we are really honoured to have been involved in this process, and we look forward to the next implementation phase, which I'm sure will be challenging but very rewarding. And we really look forward to self-care interventions as a way to really empower patients in their own care. Thank you.
Thank you very much indeed, Dr. O'Leary, and it's very encouraging to hear that perspective on the future, and we look forward to a new generation of doctors with a patient-centred care or a client-centred care that you've proposed there very strongly. Our next panellist is Dr. Samira Tuajiri, and Dr. Tuajiri, sorry Samira, I know you're Samira, but is the global lead on population and development at the Health, Nutrition and Population Global Practice at the World Bank. We've invited Samira to contribute because self-care has implications around economic and financing components. Some people may feel that this is a cheap alternative to the responsibilities of a state system. But we have to be very careful with that perspective. We need to look at the much broader picture, bigger picture of how self-care fits into a broader healthcare financing approach. So Samira, would you like to share some thoughts with us along those lines? Thank you.
Thank you very much, Ian, and it's a pleasure to be here. Just at the outset, I think this is another occasion where and how WHO has actually stepped up to the plate on the normative agenda. And I think these self-care guidelines are going to be very useful for programming at the country, the sub-country, and also at the community level. So congratulations on this. When I started hearing about this panel, I did a very quick search in the operations portal, our operation portal at the World Bank, and it allows you to do a word search, and there was no self-care whatsoever. So apparently the definition did not make it to the North Atlantic yet. But if we are going to actually address questions of efficiency and cost containment and the whole platform of the waste and health expenditure, about 20 to 40% of that actually is lost due to inefficiencies. I think there is a great potential for making self-care institutional in our work, whether it's our lending, non-lending, technical assistance, and policy dialogue. But because we only partner with governments as a business model, except on very rare occasions and cases, the reliance on a local health system needs to be anchored on a functional one. We cannot just promote self-care without actually just seconding what Charlotte was saying, is that there has to be something to fall back on for people when they are actually embark on this self-care journey, which is scary sometimes. And so the capacity enhancement of the local healthcare systems needs to be a cornerstone. Those guidelines are going to be made available to our partners, whether inside or outside the bank, and we are going to be having them as an integral part when we are actually presenting our solutions panorama for countries after the policy dialogue for new projects. A couple of points, and I am sure most of them are addressed to the guidelines, which I haven't seen, but this is just from a practitioner's point of view. Self-care, would this probably include care for others? Would this be women and burden of care? Because in some communities, most of this is actually shifted on the shoulders of women. So I think, again, this perhaps had been addressed through the guidelines, but we need to make sure that the self-care is not shifted squarely on the women in a household or in a small community or in an extended family situation. And again, also the platform and the world is a crowded space when it comes to technology, facilitating self-care, from the simple wound dressing to diabetes insulin pumps to telecommuting with doctors and other healthcare providers. It's actually so crowded that one of my sisters, who's a practicing pediatrician, has a huge sign in her office that says, "Please do not confuse your Google search with my medical degree," because we all go through this. So are we deepening the digital divide when we are actually promoting things that are squarely based on telecommuting with the healthcare professionals who are going to be providing advice, and we're encouraging more vulnerability? And then finally, just also picking up on the abortion example that Charlotte has talked about, is who's ultimately accountable? If this is also going to serve us as we swim upstream in terms of the social norms and the religious norms, for example, promoting women empowerment and agency for contraceptives or self-abortion, how is this going to feature actually if these women are marginalized to begin with, and this becomes their little secret by going, seeking abortion? And who is going to also stop these women from, it's a demand and supply issue, from actually treating this abortion as a contraceptive rather than, something that they be. So I think we need to be very careful when it comes to reporting those numbers, one, and also when actually trying to answer to a demand that may be less than what we would have thought simply because of the social stigma. Once again, thank you very much.
Well, thank you very much indeed, Samira, for those very provocative thoughts. And it's important to bear in mind some of the challenges you mentioned there, because it's one thing to provide a guideline from a technical perspective, but how it's implemented in society will vary, and that has the potential to have a counterintuitive and counter expectations of what the intention was for. I'd now like to call upon His Excellency Mr. Shamim Hassan, the Ambassador and Permanent Representative from the Permanent Mission of Bangladesh in Geneva, to present the keynote speech on behalf of His Honourable Minister of Health, Mr. Zaid Malek. So please, Honourable Ambassador, we look forward to hearing the keynote speech from your Minister of Health.
Honourable Minister from Namibia, Excellencies, dear colleagues, despite much efforts on his part, Honourable Minister of Bangladesh regrets very much that he was not able to come and present the keynote speech. The keynote coming at the later stage of the deliberations is not perhaps bad, because we'll be able to open with the key, something more important now after having heard all the learned panelists. It's a written speech, but I think I should make it shorter because much of what has been captured in the speech seems to me has been covered. So, Mr. Moderator, Excellencies, ladies and gentlemen, health and well-being for all is positioned in the 2030 agenda as an important cross-cutting issue. And we all know that the agenda has also a specific target to achieve universal health coverage. We believe realizing the SDGs would require more attention to promoting self-care interventions in this manner. Self-care interventions include self-management, self-testing, self-awareness, and it's a deliberate action on behalf of the individuals, families, and communities. It enables people to understand when to seek treatment and when to seek advice from a healthcare professional. So self-care could be emphasized as a key strategy for health promotion and disease prevention, and perhaps it enables a certain degree of empowerment as well. Under the dynamic leadership of Honorable Prime Minister Sheikh Hasina, Bangladesh has made impressive progress in the health sector over the last decade, with around 18,000 community clinics and union health centers operating in the country. Healthcare has reached our people's doorsteps. These community clinics, among others, also help empower individuals. Some NGOs are also complementing government's efforts through implementing community-based self-care intervention programs in Bangladesh. We believe that self-care will not only ease the burden of the overstretched health systems, but also will reduce cost. At individual and family levels, self-care can have a positive impact on the economy. And if correctly practiced, self-care can actually contribute immensely to rational use of medicines. Improving access, equity, and safety of healthcare lies, we believe, at the heart of self-care. While pharmacies and pharmacists play an increasingly important role in providing information and services, factors such as out-of-pocket costs may not allow all those who need services and interventions to receive them. The potential of self-care is that it can reach those who may not normally come to a healthcare setting. With increased cooperation between communities, health technology developers, practitioners, and health ministries, multi-sectoral self-care interventions can be envisioned. In view of this, I wish to underline a few points. First, it's critical to ensure that self-care is not only accessible to and cannot be practiced only by wealthier individuals in developed countries. Individuals of all socioeconomic levels must be able to access the benefits of self-care intervention. Second, the potential of digitalization impact on self-care has not been fully realized. In order to maximize the impact of digital and mobile technology and innovations, comprehensive strategies are needed to expand evidence-based self-care initiatives, implement best practices, advance collaboration, and facilitate secured data exchange. Third, not all available information is the right information for effective self-care, something that we have just heard in one of the interventions. It is the duty of health professionals to help people to be able to choose and select the right information in that situation. Fourth, it's high time to conduct operational research to develop evidence-based effective self-care practices. Establishing networks of individuals and institutions for self-care promotion could also be encouraged. And finally, countries should be provided with technical support from WHO and other relevant partners in their efforts to promote effective self-care, including in documentation, assessment, evaluation, and research on self-care practices. I thank you for your attention.
Well, thank you very much indeed, Excellency Hassan. That was a very helpful and very convincing presentation of Bangladesh's commitment to trying to really bring self-care to the forefront of its healthcare system, and we really wish you every success in moving forward with that approach. And please convey our thanks to the Honourable Minister for his strong commitment and for your engagement in co-organising this event. We're very grateful for that support and look forward to future leadership from Bangladesh in the area of self-care. So thank you very much indeed. That concludes the panel section of today's event. We have some time for some interventions from the floor, and I have 3 or 4 requests to give interventions. The first one is from the International Pharmaceutical Students Federation. And so I'd like to invite Jacinda Barbosa to give a short intervention, please.
My name is Jacinta Barbosa, and I'm speaking on behalf of the International Pharmaceutical Student Federation, IPSF. In IPSF, we believe that self-care is a critical step to achieve universal health coverage. As the Minister of Namibia so well said, we believe that we really need to put the patient in the center and have an healthcare system centered on the patient. We need to empower him and give him the control of their lives, so then we can achieve better results regarding their own health. We also very much agree with Charlotte from FMSA. We really need to be team players. We should, starting early on in our studies, be taught how to collaborate with doctors, with nurses, with other healthcare professionals. So then, when we are in contact with the public, we can really all work together and work with the patient. So we can teach them everything that he needs to know regarding their health and what is the best way to take care of his own life. And as Dr. Nordstrom said, we need to also work with other stakeholders, people from the government regarding the media, technology, so that we can together raise awareness for the importance of self-care, what we should do, and how we can do it well. As he so wisely said, we have a lot of misunderstandings, misinformations regarding this topic, and so we should all work together so we can provide the best information, trustworthy information for our patients. For us in IPSF, self-care is a really important issue that we should focus on, so we can really, as it was said by our panel, to empower the patient and give him control. Thank you very much.
Thank you very much. Thank you. Okay. Our next intervention is from the Children's Investment Fund Foundation. I'd like to invite Linda Weissart to provide a few comments. Thank you, Linda.
Thank you very much. Thank you to the distinguished panelists for this inspiring panel discussion, and congratulations to WHO for the tremendous effort that has gone into development of the guidelines in record time. For the last 5 years, the Children's Investment Fund Foundation has been investing in programs to provide adolescents and young people with the tools they need to improve their sexual and reproductive health. During this time, we have invested over $250 million to provide young people with access to services and products that can help them prevent unplanned pregnancy, unsafe abortion, HIV, and sexually transmitted infections, often co-funded programs with other foundations and governments. In particular, we are committed to advancing self-care solutions, from HIV self-testing to self-injection of contraceptives, solutions that empower individuals to take their reproductive health into their own hands and to choose the services they need. We believe that self-care has the potential, as was mentioned earlier, to accelerate achievement of universal access to sexual reproductive health and reproductive rights within the framework of the Sustainable Development Goals. Through SIF programming, we have learned that adolescents and young people disproportionately benefit when they can manage their reproductive health on their own terms. Two insights here. Our work on self-injectable contraception in Malawi has shown that women and girls have a strong preference for self-administration when given this option, and are 50% more likely to continue using the product if they can self-administer. And second, our program insights on HIV self-testing demonstrate that the younger you are, the more likely it is that you can correctly follow instructions for how to administer a self-test. So to conclude, we are delighted to hear distinguished panelists about the efforts that you are undertaking to institutionalize self-care and policy and practice in your countries. And we really look forward to supporting you and supporting partners working on the ground and rolling out the forthcoming normative guidance nationally. Thank you.
Thank you very much. And our third intervention is from the President and CEO of Population Services International, PSI, Carl Hoffman. Carl, please.
Thank you, Ian. And thank you all, very distinguished panelists, for your excellent interventions this afternoon. It's fascinating to see the political commitment, the reminder of some of the perhaps unintended consequences of important normative guidance such as this, a reminder of all the different collaborative stakeholders that need to be involved in the successful rollout of it. To us, and I'm sure other implementing partners that work in this field, it's an exciting time to know that this guidance is forthcoming. As others have said, we believe this will be a critical contributor to universal health coverage as well. My own organization's roots, PSI, lie in putting sexual and reproductive health products straight into consumers' hands, which we've been doing for 50 years. And so we embrace this movement and this continuation of the practice that's already been underway in a better framework with delight. Examples of the self-care interventions that we've been involved with in partnership with many of you in the room include emergency contraception, HIV self-testing, PrEP, self-injecting contraceptives, as Linda just mentioned, such as DMPA-SC. We've seen firsthand in this work that, of course, as many of you have already mentioned, self-care doesn't happen in isolation from the health system, or it shouldn't. Whether it's the financing of it, the labor workforce or supplies, the need to connect the consumer and self-care effectively to the health system, these are challenges still ahead of us, and we're confident that the normative guidance will help map out these aspects of the work ahead. This work will continue to require a broad coalition, and so we are pleased to serve as the convener of a group known as the Self-Care Trailblazers Group, with the support of the Children's Investment Fund Foundation and the William and Flora Hewlett Foundation, which will bring together expert stakeholders to harness this momentum and hopefully support governments at the national level as these guidelines are rolled out. So as my previous speakers have done, I want to congratulate WHO for getting us to this point. I wish to say to all the national authorities here that we and others look forward to working with you as you support the rollout of these guidelines at national level. And to those funders in the room, let me say that there's a broad group of stakeholders willing to work in partnership to ensure that these are successfully advanced under national leadership. Thank you very much.
Thank you. I'd like to invite my colleague, Dr. Peter Salama, to provide some closing remarks. Dr. Salama is the Executive Director for the Universal Health Coverage and Life Course Division at WHO. And as such, he's our leader in terms of universal health coverage generally, but particularly in terms of issues across of healthcare across the life course. And so in terms of bringing together a self-care approach from a health systems perspective, as well as a particular focus on sexual and reproductive health and rights, Peter is leading a wide group of departments within the WHO that will be moving forward with the guidance and helping countries to roll out the guidelines and to, as I mentioned at the beginning, to expand the guidelines to include other areas of health services. So Peter, please, could you provide us a few closing remarks? Thank you.
Thanks very much, Ian. It's a pleasure to be here. I'll be quite brief, just to really congratulate you all for supporting this work and getting us this far. As you know, the theme of this week's WHA has been UHC, with a very strong focus on primary health care. And one of the key pillars of primary health care that we haven't emphasized enough this week, in my view, has been the community pillar. The pillar focused on individuals and what they can do for their own health, on households and on communities, which of course is the first line of defense on all health-related issues. And the self-care work fits squarely within that pillar, in my view. This is a critical part of primary health care, which we're now exploring, explaining, and guiding in terms of information. We also know that self-care can contribute to all of the three major pillars of WHO's new strategic plan: the pillar on UHC, the pillar on health promotion, and the pillar on keeping the world safe from emergencies. As Ian has explained, we're about to launch the first consolidated guidelines on self-care interventions on the 24th of June. And from that day, we'll also be launching, with our regional offices, a month dedicated to self-care, from June 24th to July 24th. And in that month, WHO will establish a community of practice around self-care, promoting research and dialogue to ensure dissemination and uptakes of the guidelines. Fundamentally, self-care is something that people will continue to practice, they are practicing, and as we move into a world where populations age, where chronic diseases make up an increasing proportion of the burden of ill health, it's only going to become more necessary and more common for people to be practicing self-care interventions. So having the guidelines is really about empowering people with the information as they move ahead in this domain in any case. Finally, of course, to reiterate, it's not about self-care being something disarticulated from the rest of the health sector and the health system. This is about complementary interventions that link up very carefully with the health system. So thank you all for attending tonight, and we look forward to working with you in the future.
Well, thank you very much indeed, Peter. And that brings us to the end of the formal part of the evening. Before we break for the reception, I would like to again reiterate our tremendous thanks to the governments of Bangladesh and of Namibia for co-organising this event. Your involvement and support and enthusiasm for promoting the ideas and the concepts and the need for normative guidance has been really helpful to us in moving this, and we look forward to working with you as we move forward with the next phases of launching the guidelines and then helping to have them taken up. For this evening, I'd like to thank Michelina and the other young health professionals who very ably made this whole evening happen. So thank you to that team. To my colleagues in the department, Jane, Kath and Rule, for bringing together the logistics. And I'd like to thank the Children's Investment Fund Foundation for financial support in developing the guideline and for this evening's event as well. So thank you very much for that. So with that, please everyone join us outside for a short reception. And we have to go that way because there's another reception that way, so don't go to the wrong reception. Ours is this way. Exactly. So please come and join us, and we look forward to some more informal discussions around this important issue of self-care. So thank you everyone, and thanks again to the panelists very much indeed.